This is Body, Brain, and Pain. I'm Erin Babineau.
And I'm Michelle Steggy.
We are two doctors of physical therapy and orthopedic specialists here to have an approachable and courageous conversation about pain and our bodies that will be forever changing and aging.
This podcast is for everyone, not just medical providers. The better you understand pain, the more control you gain. Welcome back, everyone. Today, Erin and I are going to cover another topic contributing to the pain epidemic in our world, and that topic is over-medicalizing osteoarthritis. In today's episode, we are talking normal age-related changes in the joints through the passage of time. Now, this is different than rheumatoid or other types of arthritis that would be related to autoimmune function. So we are not saying that osteoarthritis does not cause pain ever, because it can be extremely painful and functionally limiting. But we want to cover the largest misconceptions related to osteoarthritis. And this stems from our last conversation on imaging. So Erin, give me a classic example that we see in the clinic.
Yes, a classic presentation in our clinics is that someone starts to have pain without a mechanism of injury or even following a little tweak or injury. And they kind of continue on, but eventually maybe get an x-ray. And then they're told, wow, you have arthritis in your knee or hip or low back or whatever it is. And we see it all the time. I just had someone in last week who was a runner and started doing some hill workouts. So their volume changed and their knee started hurting. And so she went and got an x-ray and they showed moderate arthritis. And she came and saw me and she goes, that's, why I have pain. And I said, that arthritis has been there for a long time. It was there before you even had that pain. So The positive of that, I only view that as positive, is that there's no reason we can't get you back to where you were. But Your pain started with that volume change. So let's talk about that.
Yeah, exactly. And that's the challenging thing of those images, is that it can create this perception of something that is bad. And we talk a lot in the PT world about words that harm and words that heal. And there's a lot of words associated with arthritis that can harm. So we're thinking, like we talked about in our last episode, degenerative disc disease, bone on bone, which is a very common thing that we hear when someone has been diagnosed with arthritis, stenosis, so changes in the spine that would also be classified as arthritis, or the doctor that tells you, oh my gosh, I can't believe that you're even able to walk with how bad that knee looks. So we prefer to use words that are healing versus harmful. So just thinking about wrinkles on the inside, that is one of the terms that I use more often than anything when talking about arthritis.
Absolutely.
We have wrinkles on our skin, we have wrinkles on the inside.
Yeah.
And the important thing to know is that there is zero correlation between the severity of what is seen on an image and the severity of symptoms that someone is going to experience.
Yeah.
There is no correlation. It could look really bad and somebody doesn't feel too bad at all. And it could be the opposite as well.
Yeah, we see people with bone on bone and they have very little to no pain and their function's pretty good. So we're not trying to negate the fact that arthritis is not painful. It's extremely painful for a lot of people. It's just not always the case. And the white elephant in my room a lot is that the passage of time is going on for all of us. So these wrinkles are more and more common. And like we said before, we're living longer. There's more of us. We're seeing it more. So how do we deal with this? And how do we prep? How do we get some preventative care? And that's what we do in physical therapy.
Yeah, it's funny. We talked about the very common comment that we get from someone who's been sent to our clinic and has arthritis. And they're like, well, I don't even understand why I'm here. You can't fix my arthritis. So what is physical therapy going to
Yeah.
do for me? So, and I've heard these comments enough that I preemptively talk about this before they have a chance to say it. So I say, you know, we're not going to fix that arthritis.
Yeah.
We can't change what's happened inside your body, but that's okay because there's a lot of other things that we can change. And that includes your strength and your control, trying to calm down your nervous system, education, just like this podcast is providing. And I very often use the example of a computer and how a computer has hardware and software. And so that hardware is the same thing as your body's bones, joints, things that we can't change. But as a computer goes, you can have you can have old hardware, but you can actually upgrade your software and improve the function of that computer. The
Yeah.
same thing happens in our body. We can improve your body's software even though we can't change that hardware.
Yeah. Absolutely. We know that through good exercises and that neuromotor control and learning more about pain, just like we talk about in this podcast, it actually helps us get you more control. And the worst part about osteoarthritis is that it can be a little unpredictable. But we know when we get strength going and more body awareness that those episodes of flares are less often and less intense. And so they might still happen, but your function is so much better throughout it. So that example of that patient up above, man, I taught her how to use her glutes when she was squatting and how to engage her quad and muscles when she was doing stairs. So squeezing her butt on the way up, and her pain dramatically changed, and then we taught them more about cueing their body if they felt pain. So again, being curious by pain. Pain is information. It's not just things we have no control over, right? And so, she would feel some of her knee pain maybe up the hill and then start squeezing her butt up that hill run, and her pain went dramatically down. And that's what's so great about a lot of that software awareness. You're right, Mish. We beat them to the punchline all the time of, nope, we're not going to fix the joint, okay? But we're going to fix all the stuff surrounding it.
Yep.
And that's pretty amazing. So,
Yep, exactly. It's just like for wrinkles on the inside, it's just like the outside. We stay out of the sun or wear our sunscreen, drink water, eat healthy food, all of these things that are the plan to try to reduce those wrinkles. It's the same thing for your body. We're just developing a plan to reduce the impact that those internal wrinkles have.
yeah, absolutely. And there is a time and place. Total knees and total hips, I'm not kidding. I rate them as top surgeries in the world, not just orthopedic surgeries, but surgeries. They're amazing and they're wonderful. And we have amazing surgeons in the Twin City areas that we work with for when that time comes. And Michelle and I are both pretty blunt PTs when it comes to, wow, this osteoarthritis is getting unpredictable and it might be time for surgery or consult. But I remind people we get surgery based off pain and function changes. Again, not based off that image.
Right.
And then even if someone is a surgical candidate, so it happens all the time. They come in and they're like, Dr. blah, blah, blah wanted me to come in and do some PT. Don't know why I'm getting a new knee in, 3 months. But the reason why you're in our office, it is not a waste of time at all. The best predictors of post-surgical outcomes for these new joints are pre-surgical strength and function. So even the power of some prehab before surgery, it is, again, it's so great. And it makes your post-surgical time with rehab so much easier. So you learn more about your body, you learn how to use these muscles, and wow, after surgery, it just goes a lot smoother and you get better faster most of the time. So
Yeah, absolutely. And that prehab time frame is a great time for education too.
Yeah.
A lot of hospital and health systems will actually have these education sessions before surgery because it's super helpful for knowing what to expect.
Yeah.
it's a great time to learn more and understand pain better. And so the prehab time frame is very important as well. So,
Absolutely.
and we always talk to people about timing too for those joint replacement surgeries, because the timing is based off of you. It's not
Mm-hmm.
based off of your image. Your doctor isn't going to tell you based off of that image, here's when you should have surgery.
Mm-hmm.
It's based off of your function, pain, timing. So what timing works best for you?
Yeah,
When are you going to have the most community support? When does that joint replacement fit into your life? Because
exactly.
that's going to be one of the big factors for success too.
Yeah.
So it's a very personal decision, and we're here to support you through that decision. Erin, I love this. You always say, as PTs, we're tour guides through the
Mm-hmm.
medical system, and we're here to support you for that. And you are in charge of what happens next and your body.
And we'll give you those facts about, surgical successes. What are those determinants so that you are aware of what's being researched. I always say
Yep.
knowledge is power. One thing we saw in the pandemic was people who had to cancel their surgeries, right? So these
Mm-hmm.
orthopedic surgeries were canceled, and I had a lot of people be so upset at first. And then afterwards, when they started some PT with me, they were like, oh my God, I'm doing great. And I'm so glad. Like, I wanted to put this off a few years. It doesn't work in my life right now. And
Yeah.
their outcomes post surgically were amazing. And
Oh,
I had a
definitely.
few even that were like, I don't need this. That was pretty cool to see.
That's awesome.
Hmm.
Very cool. So, another topic that we want to cover before we end this episode is a question that we very often hear in the clinic and just in general in our communities. And that's the question of, is running going to cause arthritis?
Hmm.
Short answer is no.
Yes.
For those of you that aren't going to keep listening. Um, no, so I want to talk about a study that came out that looked at this question. And I will tell you that it definitely shook the orthopedic world, and in a good
Yeah.
way. So the question was, does recreational or competitive running increase the risk of osteoarthritis? And so they had three groups. One was sedentary individuals, so people that weren't running or participating in an exercise program. One group was recreational runners, and the third group was competitive or elite runners. And so they found that the group that actually had the lowest incidence of osteoarthritis was the recreational runners group, which is awesome.
Hmm.
I was like cheering when I saw
Yeah.
this. I was like, this is fantastic. So the recreational runner group showed a rate of 3.5% for arthritis. The non-runner group showed a rate of 10.2%. And then the competitive runner group showed 13.3%. So, first of all of those rates are very
Yeah.
low, which is great. And the fact that recreational running had this lowest rate tells us that running can actually be
Hmm.
protective for our joints. And we see this in other areas as well, but that's really good information.
I love this study. It really reinforces the fact that all of our bodies are super strong, and impact in moderation and at a highly competitive level is actually a good and okay thing for joint and bone health. And most of the time, I like to say, if there's issues, it's more about listening to your body and what it's tolerating. So, that volume discussion, and then also that software discussion. So, what's happening in our strength and nervous system, our muscular neuromotor control. A community example that comes up often. How many friends have you had call you, Mish, about like they're your avid runner and they're starting to have consistent knee or hip
Yeah.
pain? And they're running 5, 6 days a week. They have no software resilience plan. Again, that's that strength or neuromotor control plan. And they're just not tolerating running
Mm-hmm.
anymore. And these are my friends in their 30s and 40s, but they've never strength trained in their life. And now their body is just saying, man, we need that support. And so, again, it's so healthy for our joints and our bones to have that strength plan that gives it healthy loading and then also builds us up to support impact. So it's not black and white, no running and running 6 days a week. I always say there's so much more in between for people. And it's all about what works for your body. And remember, that's always changing.
Absolutely.
So learning to listen to that.
Yeah. And it's, it's a bit of a mourning process and dealing with this passage of time and seeing that like, man, I guess I can't do that 6 day a week training program that I did when I was 22, But you have to learn to barter with your body and understand that it's forever changing. It's always something that you're having to adjust based on where you're at in life. And knowing more about pain, understanding more about these wrinkles and what they mean and what you can do about it, that's all normal. And listening to your body, learning how to nudge, those are the things that can be extremely powerful in how you continue with that training program, even if it is a little bit different than it used to be. These are all examples of how we can continue to age gracefully, right? So
Absolutely.
it's a lifelong change. It's something we're always doing. So remember, if you have any questions, don't hesitate to email us or send us a direct message on social media. We are happy to answer any questions you may have. Thank you again for joining us and have a wonderful week.
Thanks, everyone.